I'm Anton Pozniak from the disunited kingdom of Great Brexit. That's about the only joke I'm going to say, because actually, however many jokes we have, it's no joke. So I want to also, in my talk, it's much more political about what you can do in the face of trying to get PrEP implemented in your country, or even to change things that are already happening. And this is about the long and winding road of what's happened in the UK. Now, we don't have these types of posters in the UK because we have no public provision of PrEP. This is from New York and all over a lot of the states now. You'll see this sort of thing where they've had PrEP provision for several years, and we need to have this in my country and in all the countries around the globe. Now, it's really interesting because we did a landmark study in the UK. This was the PROUD study, and again, you've heard these 86% efficacy. You know, this is marvelous, fantastic, amazing results in people at high risk, and you all know about this data. So remember, we had a landmark study. We also, and I'll try and show this is the amount of testing going on in one of our clinics, and this is what happened, and Andrew Hill showed some of this data to what happened to a number of HIV diagnoses. And it's really interesting that we were testing a lot of people. We already had started, and Andrew Gurelich also showed this, that, you know, very early treatment, but then people started to buy, because we didn't have PrEP in the UK, PrEP on the internet. So all of these things put together, we've now decreased that, and within this there's an impact of PrEP. So we did a landmark study. We've got an impact of PrEP that we can show, but what happened? Well, we still had no policy for PrEP. So let's talk about bringing in the law. So NHS England, that's our provider of healthcare, it's free to everybody in the UK, their decision making on PrEP. A couple of years back, they said, we don't have the legal powers to commission PrEP. We have a landmark study, we have evidence, because it's prevention and we only really fund treatment. So there was no clarity who should commission the drug. So we had you can see why we're in a Brexit mess, huh? So now we've got this issue. So what do you do? And of course, what you have to do is have the voice of the people. If the government can't do anything and are paralysed, we get community involvement. United for PrEP, and this was a fantastic movement. And I think it's undersung, actually. So, Women and PrEP, clear community consensus, coordinated engagement. There was a website called PrEPster, gave people information on PrEP, how to be active in fighting for its implementation. I Want PrEP Now website. You could buy PrEP online from overseas. In the UK, it's legal to do that. You can do it. Now, if you wanted to go and buy it privately, it was at least $350 US a month, right? So, if you bought it on the line, it was 30. So, who wouldn't go and buy it online? You couldn't get it free from the NHS because it wasn't allowed. The sexual health clinicians, and our clinic was the first clinic to set up a specific clinic where people could come and be checked for HIV, as well as have their drug levels checked of the PrEP they're taking, in case because people were concerned it was not high quality, and we could do their blood tests. Now, these were treatment clinics, yet we were running prevention clinics within that. And in fact, the only one person whose drug levels were low, who was on PrEP, had bought their drug from Gilead. And it wasn't Gilead's fault. They admitted they weren't taking it. And we started to have campaigning in the media and work in Parliament. So the National AIDS Trust, fantastic group, they took NHS England to a judicial review in the High Court, and then in the Court of Appeal, and both times this NGO won. And the NHS England had to accept the Court of Appeal judgment that they could commission PrEP. And the real reason was the High Court said that as PrEP was both prevention and treatment, a group can start to commission it and do it. However, the decision-making process was all started again, and they said, well, maybe we could still reject PrEP. It was an incredible mess, even though 2 court appeals. So we had some good results. But instead of saying you've got a good quality trial, we've got evidence that it works, you've got generic PrEP, which is treat, which obviously we can't buy. What we want to do with you guys now is not commission PrEP for everybody, but we want to do a study. So they gave £10 million, which is a small amount of money in terms of drug costs and commissioning, to say they will give this to put 10,000 people on a PrEP. So it was a trial, basically, like you saw in New South Wales. And in fact, interestingly, although the government through clinics couldn't give generic PrEP, they could through the trial. Okay, so the trial questions are pretty obvious. What proportion of people going to the clinic will take PrEP? Who's going to accept it? What length? How long do they take it for? And the two more difficult questions: what is actual impact on HIV incidence in the population, and the STI incidence in the population? So what happened? It was incredibly popular. Why? Because if you sign up to this, you get PrEP for nothing. Whereas otherwise, you're spending at least £30 of your money every month. So, and you get guaranteed follow-up and everything else going on. So if you want PrEP, you might as well sign up for this rather than try and do it by yourself. So 10,000 participants were already, by Friday last week, enrolled. The speed of recruitment significantly exceeded initial expert predictions. Never believe what experts tell you, right, about what's going to happen in the future, because they often get it wrong. And it was obvious to all of us sitting there going, there are thousands of people who want it. So 10,000 people went in the trial, and the others who are still buying PrEP on the internet. So what's happened now? They want to increase the trial up to 13,000 and then up to 26,000. That will be a significant number of high-risk gay men entering the trial finally. So, well, we still don't have it through the NHS. They want to wait till 2020 till the trial's all finished. But in the meantime, as in the usual British fashion, we are prepared. We are prepared with guidelines on the use of HIV pre-exposure prophylaxis. So my final comment to you is, do not give up. So if there is something you think is wrong, get the community organized, work with them. I know this has happened a lot in Thailand, but in other countries, it's really the things you can do, and actually taking the law and going through legal routes can be very, very useful, right? So, and there are a lot of HIV activists in the world who have done this. You have to stand up and you have to be counted. And that way, maybe we can get our dream of PrEP globally instituted come to a reality. Thank you.